Hey guys, I decided that I wanted to do a more informative video. I'm sorry, my hand's in the shot. A more informative video about treatment. I'm probably going to do it in two parts. I'll start with, this one's going to be about what to expect when you go for CBT, and then I'll do another video about medication that I'd taken. So, what to expect when you go for CBT. CBT stands for cognitive behavioural therapy. I have to say it slowly. And basically, it's all about changing the way you think. And I didn't go through the NHS. I actually went to a private hospital to have my treatment because we had Bupa health insurance, so it was easiest to do it that way. The hospital I went to, it was mainly had inpatients, but I was an outpatient, and it's literally like the biggest mansion you can imagine. It looked a bit like a palace from the outside, and it's got all these grounds, and it looks quite intimidating, but that's where I went to start my CBT. And on the first time you go to the therapy, you're probably just going to be talking about your life and what your family situation is, your past, and the therapist will ask you quite random questions that you think probably don't have anything to do with it, but they are trying to build up the most accurate picture that they can of you, and so that they can help you the best way. So I went to that initial consultation, and then it was supposed to be 6 sessions after that, but I think it ended up being closer to 12 because she felt I needed it and I felt I needed it. Obviously it depends on the condition that you've been diagnosed with as to the exact type of therapy that you receive, but because I mainly worried a lot about my health and about things in general, I was given a chart where I first had to write down what I was worried about. So say if I'm worried about a presentation at school, I'd say I'm worried about making my presentation, and then I would say how worried I am. I'd rate my anxiety out of 10 and say I was 8. And then I had to say what's the worst that can happen. And the worst that could happen, like, for example, would be that I'd forget what I was saying and that I would make a fool of myself. Then I had to write down how out of 10, how much I actually thought that bad thing, the worst, was going to happen. Like how much I thought in reality that I would forget what I was saying and make a fool of myself. And let's say it was about 4. And then once I'd done the presentation, I then had to say what happened. For example, I remembered everything, it went fine, I got a really good mark, and then rate my anxiety, a 1. And as you do this with your worries over time, you see that 99.99% of the time, your worries are completely futile and completely just non-productive. You get taught the difference between productive and non-productive worrying. Productive worrying is, I think I remember this rightly, is if there's a reason for it, if there's a good reason, and if you can solve it. Like, if you're worried, I can't think of a good example. If you're worried about a broken tile on your roof or something, I don't know, that's the first thing that came to my head, then the thing you can do about it is that you can get somebody to look at it and make sure that it's safe. But if you're worried about a presentation that you've got to do, that you are going to have to do, you can't control, you can't make it come quicker, you can't do anything about it, you're just worrying for the sake of worrying, then that is an unproductive worry. So what was that? I don't know. So the difference between productive and unproductive worrying is taught, and you also get taught all the different types of mental state. For example, I think that's the best word I can think of. I can't remember any of them. I had a list in my head and now they've all gone. It just shows what happens when I get put in front of a camera. There's like catastrophe. Thinking that the worst is going to happen. I'm trying to think of the word catastrophe and putting it into a word, catastrophizing. I don't know. But basically, all or nothing. That's it. All or nothing thinking. Where you think that either everything's going to be fine or that it's going to go horribly, horribly wrong. Like, for example, when I thought that I was ill, I always thought that either I could be completely fine or I could be dying. There was no in between for me. I'm trying to think of another type of worrying. The sort of worry that, the sort of thinking that is very negative, self-negative. Like, if something goes wrong and you automatically blame yourself, you think, oh, it's my fault, I must be a terrible person for this. Perfectionistic thinking, believing that you always need to do everything right and you can't acknowledge that, you can't accept it when things go wrong. There's loads of them. There's a list of like 10 of them, and in like one of the first or second sessions of CBT I got asked to tick all the ones that I thought that I could remember, that I can identify with, and I think I ticked pretty much all of them. And then basically I got taught to change my state of thinking basically and challenge my own negative thoughts, because if I challenge my own negative thoughts and stop my mind controlling, like my unconscious mind controlling my thoughts and letting my conscious mind take over, then it takes a lot of practice. I still have to, even it's been like a year and a half, and I still have to think about what type of worry it is, if it's productive or if it's unproductive, the type of thinking that I'm experiencing, how, and then I physically have to challenge my thoughts. Sometimes I do it out loud. I think, no, everyone makes mistakes, this is okay, get on with your life. And it takes a lot of practice, but it gets there eventually. So that's a little explanation of what cognitive behavioural therapy entails. Obviously it's different for everyone and different therapists do it different ways, but that's just what happened with me. So I'm going to make another video now. I'm going to make it about medication. See you guys.